各位傳媒朋友，早晨。
Good morning. Welcome to the press conference on anti-epidemic work. Apart from the Chief Executive, we have Secretary for the Environment and the Acting Secretary for Home Affairs. The CE and officials would speak before the floor is open for questions. Please keep your masks on at all times and maintain social distancing. Chief Executive, please. Friends from the media, members of the public, good morning. First of all, I'd like to thank you for attending the press conference on anti-epidemic work on a Sunday, together with the Secretary for Environment and Acting Secretary for Home Affairs. I will brief you on a key anti-epidemic measure, that is the restriction testing declarations, or what is commonly known as a lockdown order, or in short, RTD. The goal is to achieve zero infections on a district basis. The legal basis is same as that of other compulsory testing notices under Cap 599J. The Secretary for Food and Health would issue notices on certain individuals in a compulsory testing notice. Individuals in a restricted area would be subject to a compulsory PCR test within a certain period. As I said at the press conference on March the 17th, through restriction testing declarations, we identified a large number of positive cases. Apart from identifying infected persons early, we are able to assess the extent of the spread of the virus in high-risk areas, and inevitably, the operations would cause inconvenience to residents, since during the testing period, residents are not allowed to leave their places of residence save for testing. So we would like to thank residents for their cooperation, and we hope the exercise could reassure them of their well-being. If we are able to curb the transmission chain soon, that would be beneficial to all. During the fifth wave of the epidemic, I visited two housing estates in Tongchong and Tuen Mun, and I met members of the public as well during the RTD operations, and they largely agreed or supported our work. In fact, the operations started before the fifth wave of the epidemic. In early 2021, we saw a large number of cases in an area in Jordan. That is why we imposed a restriction testing declaration. And since the fifth wave of the pandemic started, we had numerous RTD operations. So far, we have held more than 250 such operations. Yesterday, 4 areas were subject to RTDs, and the operation is still ongoing. Our goal is to complete such operations within a day. That is, if a declaration was made yesterday afternoon, the operation should complete by the afternoon of today. More than 350,000 residents were affected by these RTDs. The number of preliminary positive cases exceeded 23,000 cases. Owing to the severity of the fifth wave of the epidemic, altogether, we have found more than 1 million positive cases through PCR and rapid antigen tests. For the 23,000 cases identified through the RTDs, even though they might only make up 2 to 3% of the total, But if we did not issue the RTDs on time and identify these places, we could see even more widespread transmissions. Since the LTDs would cause inconvenience to the public, the sooner we can complete these operations, the more we can reduce the inconvenience on the public. And in order to complete these operations in a swift manner, we must carry out sampling in an efficient and orderly manner. And this would also safeguard the well-being of the residents. And the samples would be transferred to the laboratories for analysis, and once results are available, residents would be informed as soon as possible. More than 250 RTD operations were held. Only 17 of them lasted more than 1 day. That is, they weren't completed within 24 hours. In Yat Kwai House of Kwai Chung Estate, a 7-day lockdown was imposed. In order to complete the RTD swiftly, we needed a large amount of manpower. And so far, in the operations, 150 to 450 civil servants were mobilized each time. Initially, the HAB, HAD, as well as LCSD and the THB, HD were involved. Right now, more than 30 departments are involved in RTDs, and they had experience taking part in such operations. These include the Trade and Industry Department and Hong Kong Observatory under the CDB, and the Inland Revenue Department and Official Receiver's Office under the FSTB. In our press releases related to these RTDs, we specified the residents in restricted areas that who were subject to testing. Initially, everybody would be subject to testing, but as we see more and more positive cases in Hong Kong, we are starting to see a differentiation. For those in restricted areas, if they tested positive to COVID-19 after December the 3rd, 2021, they would no longer be subject to compulsory testing. And as the experts from the CHP explained, for someone who had tested positive, they would not be infectious for at least 2 or 3 months, and their viral load would be very low. And meanwhile, for those who were vaccinated, to play safe and in light of the high transmissibility of the Omicron strain, those who were vaccinated or those who had taken PCR or RAT tests recently, they would still have to be tested in RTDs. So those who had tested positive do not need to be tested, and those who were subject to multiple tests and vaccinated would be subject to such tests.
Second, in the RTD operation, if there are preliminary positive cases and they have to be sent to quarantine centers, I hope that the public would cooperate with us, because this would be safer for the household contacts, and it would also be safer for the block of flats as well. We understand that it would take about 4 days to be in the isolation facilities. We will step up the management and services of the CIFs. Now, we are seeking to protect the community, and I hope that people will move into the CIFs in accordance with our requirements. RTD is really objective-based, so the sewage surveillance is one of our measures. So I will defer to the SCN, who will be taking us through the sewage surveillance, and then the SHA will be talking to us about what kind of support will be given to the buildings and also the responses on the part of the occupants. SCN. Chief Executive, fellow citizens, friends of the media, sewage surveillance started in the year 2020, not just in Hong Kong, in European and US jurisdictions, Singapore and the mainland. To varying degrees, they have developed and used sewage surveillance to identify COVID. Hong Kong is leading in this area. Together with the multidisciplinary team of the Hong Kong U, we have developed since 2020 these surveillance work, and all these are intertwined with the COVID measures like the RTD and the distribution of anti-epidemic kits and so on. I'm grateful to the EPD, the DSD, and the multidisciplinary team of the Hong Kong U for their cooperation over the past 2 years. The sampling team and the lab teams, we have about 400 or so people assisting in this sewage surveillance work in Hong Kong. And this is going on solidly. We go around Hong Kong to do the sampling, and then we take the samples to the labs for analysis. All this work will take the team into these 1 hours of the day for the report. As of the 9th of March, the EPD and the DSD have held a press conference online to explain the relevant work. I'm grateful to my colleagues for working flat out round the clock to conduct the exercise. During the first few days of the Lunar New Year, they still continue with their work. Second, about this sewage surveillance, there are two means. One is the regular sampling points and also the non-regular sampling points. All these will enable us to track and also to uncover the hidden carriers. Now, for the regular sites in the fifth wave, we have more than 150 regular sewage sampling sites covering 5 million people, and we're covering the sewage discharge from the households. We have a cycle of 2 days. Now, for the 5 million people, we have the rapid group test. I'm going to talk about how we're going to use the data. Second, in the regular sewage sampling sites, if they demonstrate higher risks, or if there are sites that we cannot cover in the regular exercise, we also have some mobile sampling sites for sampling purposes to supplement the data. We will collect the sewage from upstream in order to get the more precise data. So these regular and mobile sampling sites enable us to assist in the anti-COVID efforts. We have 30 or so these sites per day. Also, these data are scientifically based to enable us to track and anticipate the development of COVID. Now, let's take a look at this chart. The chief executive has showed this in previous press conferences. The blue line shows the trend of COVID using the 2-day cycle viral load. The orange-pink shows the PCR positive cases and also the RAT, rapid antigen test positive cases, and the trend of these positive cases. The two trends are consistent with one another. if you look at the values, in accordance with the peak values, at the end of February, the peak happened in accordance with the PCR and RAT data. The peak happened in March, and there were a couple of days, about 4 days gap. So this is consistent with the data arising from the epidemiological data. And here, the chief executive also showed this. We have added the latest 4 days figures on the blue part here. 4 days ago, the COVID situation was hovering around a plateau. And with the 4 days additional data, we are looking at a slightly downward trend, although there is fluctuation. There is every likelihood that it might rebound. So I think we have to make sure that we maintain the social distancing measures. Now we can observe the trend over a 4-day period. And from these sewage surveillance, and also from the data received by the health authorities, we have a consistent trend there. So all these will enable us to predict the way the pandemic is going. Also, the APD, on the basis of different districts, are distributing the anti-epidemic kits. I'm grateful to the HAD for the distribution efforts. The COVID Omicron variant is spreading pretty fast, starting from March. In accordance with the regular sampling points and the mobile sampling points, we pick up all these high-risk areas and distribute the RAT kits. In our press conference yesterday, of the 18 districts, the Sheng Shui, Qinghua State, Guangfu State, and Taipo represent high risk. So we distributed RAT, 110,000 sets have been distributed. Since the beginning of March, because of the high risk arising from the sewage surveillance, we have distributed over 3 million kits of RAT. And so we have some indication about the high-risk area. So this is the indication that we have.
In terms of the restriction testing declarations, we compiled 2 sets of key figures. One for buildings with multiple positive cases, they would be subject to an RTD. As the chief executive said, since January the 27th, the RTDs were issued based on the high-risk sewage surveillance sites. Almost 180 cases were found through sewage testing, and more than 240,000 people were subject to sewage testing, and more than 23,000 positive cases, or 10%, were detected. There were certain recent samples like Shentin Estate, and more than 20% of the residents subject to sewage testing were found to be positive, and in certain buildings the ratio was as high as 30%. I'd like to thank the chief executive for her support in our sewage surveillance work, and I'd like to thank the EPD and the HKU team for their efforts. By making use of science, we are able to tackle the pandemic. Mr. Chen, please. Thank you very much, Chief Executive. Restriction testing declarations are a key part of the SAR government's work. The idea is to identify the more risky areas through sewage surveillance in order to identify affected persons. That way we can act soon and achieve early detection, isolation, and treatment. The operation is mainly carried out by the HAD and EPD. More than 90 operations were carried out. More than 78,000 residents were subject to RTDs. The LCSD is also responsible for standalone RTD operations. Initially, there were 1 to 2 RTDs every day, and in recent times, as much as 8 districts were subject to RTDs involving more than 10,000 residents. Through the district offices and the LCSC, we strive to provide ample support. And the work includes securing the particulars of residents, facilitating testing, reopening the restricted areas. We have also arranged for foodstuff and necessities for the residents, and these include supplies from the mainland, such as proprietary Chinese medicine. The residents could feel the care provided by the SAR government and the mainland government. And the operations require the collaboration of different departments and offices. The FHB would first decide on the buildings subject to RTDs, and they would work with contractors. They would decide on the number of tests needed and the arrangements for releasing the restricted areas. And the work would be taken up by the government departments on duty, like the CDZ, 8 policy bureaus and 39 departments under these bureaus have mobilized their manpower. The work include maintaining order, distributing supplies, manning hotlines, answering residents' inquiries, facilitating the testing for residents, registering the particulars of residents, and after the tests are completed, they would verify whether all residents have completed the tests. And after the RTD operations, those who tested positive would be transferred to community isolation facilities. In each RTD operation, on average, 150 to 450 civil servants would be deployed. We understand that the RTD operations would cause inconvenience to the public, but in order to fight the pandemic, we hope that residents would understand and support our work. The government departments and staff would strive to complete the operations as soon as possible. And in light of the sewage samples that tested positive in different districts, the HAD and district offices would distribute RAT kits to residents and management companies. Through the FHB Government Logistics Department, the HAD has distributed more than 4.2 million RAT kits to residents, and through the Hung Yi Kuk and rural committees, more than 280,000 kits were distributed to rural personnel, and through the 8 integrated support centers for ethnic minorities, anti-epidemic kits were distributed to ethnic minorities. We also mobilized volunteers to distribute more than 4.1 million test kits and a large amount of proprietary Chinese medicine. The floor is now open for questions. Please raise your hand and identify your organization before you speak. Please speak into the microphone. The lady in the middle, I'm from Commercial Radio. Chief Executive Professor Yuen Kwok Yung said international flights to Hong Kong could resume. Would this be considered by the government, and if so, when would it be done? Are you concerned that if you simply look to prevent the importation of cases, you would not be able to bring the pandemic under control? Some experts analyze the mortality rates of COVID-19 in Hong Kong, and they feel that elderly people should receive the community jab. But currently, residents in RCHEs would receive Sinovac. Does the government see it fit to relax the social distancing measures now? Some civil servants indicated that LDDs are no longer necessary right now, and they were not happy with the arrangements. Very often they had to work for 2 straight days, so they had quite a lot of complaints. Chief Executive, what is your view on such comments? You asked a total of 4 questions. Professor Yun talked about the resumption of international flights. After the 5th pandemic started, we implemented a territory-based flight suspension mechanism. That is, flights from 9 regions were banned. It was a very stringent measure, and such measure was only adopted by UK for a short period of time since the 5th wave started. So both Hong Kong residents and non-residents would not be able to return to Hong Kong from these places. So it was a very stringent measure, and a few days ago I have said that we have to review such arrangement. We have no announcement to make today in this regard. Such arrangement or this idea is somewhat related to preventing the importation of cases. That is, even if we relax the international flights, it doesn't mean we would let our guards down on preventing the importation of cases. We still have a few hundred travelers coming to Hong Kong every day through the airport. So even if such flights resume, we would still have certain requirements in place on inbound travelers. But in terms of the details, they would be announced in due course. And in terms of the mortality rate, Hong Kong has seen numerous deaths in the 5th wave of the epidemic. Yesterday, together with the Chief Executive of the Hospital Authority and the staff of the CHP, we had a discussion. We had to analyze such deaths in detail. Professor David Hui carried out a small-scale analysis, and he said that 40% of the deaths could be related to COVID. Another 40% were related to chronic illnesses or specific diseases. But these patients carried the virus at the time of death. We saw cases in which certain patients contracted COVID before their death. So we must let the public and international community know of the deaths in Hong Kong during this wave and the underlying reasons.
As to the vaccination for the senior citizens, in the vaccination program, we do offer choices, and the expert committee would let the public know about the situation regarding vaccination and the intervals between the vaccine, the doses. Now, Sinovac is a very effective vaccine in itself, and the way it is administered is all right. So under what circumstances should one choose what vaccine will be an individual choice. On Thursday, on the 17th of March, I said that despite the fact that all these measures announced on the 22nd of February will be extended to the 20th of April, we will be conducting an interim review. And I must point out, however, that the COVID situation is still severe, although we have hit the peak, apparently, and there is a downward trend. However, from the sewage surveillance, we can see that there can be a possibility of a rebound. If you look at the mobility numbers, on the basis of the Autopass card, there is an increase in the mobility. So I think we have to have regard to the development of the pandemic when we consider all these social distancing measures. After April the 20th, what sort of situation would it be like? And would there be any phased relaxation for the businesses? I hope that we should be able to make it clear tomorrow. On the fourth question, I also have a retired colleague, a senior one, who indicated the situation that you mentioned. I'm not sure whether you learned about this from the Facebook of this individual, but this is not a widespread situation. I've asked all the department heads, and I've also been to Tuen. As I said, the response that I receive is that the colleagues from the 30-odd departments are really coming together. They would like to go to the front line and make their contribution to the battle against COVID. Now, there is a policy bureau that said to me that they have been training the colleagues for a long time. They haven't been given opportunity. They would like to be involved in the RTD operation, and they'd like to be offering their services to the members of the public and do their bit. There is a difference between the front line and away from the front line. When you go down to the front line, when you get in touch with the people of Hong Kong, you have a different feeling. So I haven't received any response from any departments, any of the resentment that you refer to. Now, people may be putting in 20 hours plus, but after the RTD operation, after the sampling and before the results are announced, there is a bit of a gap, but they do have to get on with their work afterwards. Now, people are working very hard, but this is well worth the efforts. The colleagues are really coming together and stand united against the pandemic. If you have more information about the civil servants who feel that they don't really want to do this kind of work, I'd like to hear about it. I'd like to hear about what departments they are. Now, there are more civil servants colleagues who are willing to take part, then we're able to arrange for them to do so. Now, there may be one or two words on social media that express what you said. Is it a widespread situation, or is it the case that someone expresses their views on an individual basis? The lady in white at the back, please. Towards the left, please. TVB. The number of positive cases has come down, but every day we see an increase in the number of community testing centers. The utilization rate is lower, and also we're seeing an increase in the number of mobile testing stations. Why this arrangement? Is it a wasteful use of taxpayers' money? Also, there are some views in the community that with the easing of COVID, there should be a committee to be set up to look at the government's response to the pandemic situation. You're going to set up such a committee. Also, before the Mainland Express came, you didn't have any designated COVID clinics. I mean, it's the case that you wouldn't do anything until you're instructed to do so. 3 questions there. First of all, about the PCR test. Now, for PCR tests, as rapid antigen test is gaining popularity, there are less PCR tests being done. People know that they don't have to queue up, they don't have to make an appointment, they don't have to get a ticket to do the RAT test. The government has also recognized the RAT test results. And for positive cases, they will be recognized as such, and the numbers will be added to the tally. And they don't have to turn up at these these centers. So it's only natural that the number will be coming down, but we have to reserve this capacity. And we would like to maintain a capacity higher than the demand. I would like to have the hospital beds available. We'd like to have the CIFs available. We should have the spare capacity. We hope that we would have spare capacity for our vaccination program, and also for the sampling and the testing capacity labs. We should have more capacity than the demand. Over the past half a month or so, we're hovering around 120,000. Now it is down to 80,000, and that's a reflection of the situation that I referred to. The FHB has been adjusting the situation. Now, we do have the strong capacity to cater for PCR tests. The FHB will be continuing with the CTNs, although not on the basis of RTD. Now, if they spot any particular risks in a building, they would issue the CTNs, the compulsory testing notices for people to turn up at the community testing center or the mobile centers to get tested. Now, I think I have to be grateful to the contractors involved in the testing. At the height of the testing, when demand outstripped supply, they introduced all these Huoyan testing lab, and mainland people have also been arranged to come to Hong Kong. I think we have to utilize the capacity to the fullest so that we can identify cases as early as possible. Hong Kong is faced with such a massive wave of the pandemic. Of course, there are certain areas that we can review with the benefit of hindsight. I think the review should be very broad in scope. As I said, for the senior citizens, they have become a group with the highest mortality rate. I think we have to review that. The protection measures of the elderly homes should be reviewed. In taking forward the public health work, like the SARS epidemic. After the SARS epidemic, we also conducted a whole series of review, and we implemented a whole lot of measures that should have been implemented. We have set up the 3-tier response system. We have used this in this epidemic, and at the Princess of Margaret Hospital, we have set up the Infection Control Center. So in terms of the government, in terms of the members of the public, or in terms of the corporations, I remain open-minded.
In terms of the participation of private hospitals in anti-epidemic work, I do not agree with your view. I have been with the government for a very long time. I believe the interactions between the government and different sectors is a two-way process. We must look to identify the difficulties faced by different sectors. Initially, hotels were reluctant to be converted into quarantine facilities, and likewise for private hospitals, they must know what the actual requirements and they must understand the support provided. Most private hospitals do not have negative pressure wards, so the government provide ventilation and facility support? And does the government wish to transfer COVID-19 or non-COVID patients to private hospitals in order to relieve the burden on DHA? So all these require two-way communication. So with communication and understanding as well as resources, we can get things done. Dr. Ho Siu-wei from the Federation of Private Hospitals said this morning that they are doing their best to mobilize 1,000 beds, and there is still a surplus capacity. DHA is yet to decide the types of patients who would be transferred. So whether for hotels or private hospitals, I see that they are willing to support the government's work. But we need to sit down and discuss how we collaborate. So I'd like to express my gratitude to the 13 private hospitals for their support and effort. Next question, please. The lady in black.
Good morning from the South China Morning Post. Mrs. Lam, why have the government policies been reactive rather than forward-looking, especially in terms of the cap on private household gatherings being implemented only after the Chinese New Year holiday, and potential changes to quarantine and flight bans only after massive brain drain and when Hong Kong's international status was at stake? And is there a roadmap for resuming normal living in the near future, or will all scheduled premises need to wait until at least after April 20th to reopen? Thank you.
Well, a few days ago, I think it's on Thursday, the 17th of March, I did acknowledge that although I said on the 22nd of February that all the control measures that were put in place, whether it's border control or social distancing or the suspension of face-to-face learning or class education, will last until the 20th of April, because nobody would imagine at that point in time that this very unprecedented fierce fifth wave will subside within a short period. But having gone through a month and having gone through the peak that you have seen here, I think a responsible government should regularly and vigorously review these measures to see whether there is room for adjustment. I wouldn't promise now that there is room for adjustment, but following a review, we have the duty to account for the findings in this review and the direction that we will take. So you will have to wait until probably tomorrow when I present the findings of our one-month review of the implementation of the various measures. I wouldn't readily accept that we are always lagging behind and not forward-looking. As the Secretary for Environment has illustrated to you, the extensive use of sewage testing is a very forward-looking measure. So instead of waiting for residents to be infected and then identified and then isolated and treated, on a very massive scale, we are surveilling the sewage of 5 million people for the last 1.5 years. It's costing quite a lot of money, I can tell you, but this is money worth spent in order to have a very good picture of the Hong Kong's virus situation. Now, the brain drain is caused by a lot of factors, and Hong Kong has gone through various stages of so-called brain drain or the loss of talents. But at the same time, we are also bringing in talents. I've been giving you figures under the Quality Migrant Admission Scheme, where we have to double the annual quota twice in 2 years. So that proves that Hong Kong remains very attractive on a medium to long-term basis because of the abundant opportunities available to us under the 14th Five-Year Plan, under the Guangdong, Hong Kong, Macau, Greater Bay Area. But inevitably, some people will take a shorter-term view that they are worried that they could not travel, they are not happy that their kids could not go to school, and so on. But this is Hong Kong. We have freedom of movement, and people come in and go out as often as they would like. Now, I don't know whether I heard your accurately, you said we were late in putting in place the social distancing measures after the Chinese New Year. That was not accurate. We announced and put in place very severe and the most stringent social distancing measures on the 7th of January. And if you look at the chart, what happened in the 7th of January is only a sort of handful of cases. And at that time, I was being criticized and attacked for being sort of exaggerating the virus situation. Okay? The scheduled premises were all closed from the 7th of January, except the barber shops and hair salon. And evening dine-in was suspended from the 7th of January. That was well before the Chinese New Year, which fell on the 1st of February. So I'm very happy to answer questions, but you have to possess the facts in asking questions, if I heard you accurately. So this is, again, not a factually accurate comment, but it's duty-bound for me to clarify. But this has proven to be absolutely necessary. Although judging from the confirmed cases, people are still worried whether we have been effective. But you just imagine if we have not put in the social distancing measures, people still went out as frequently as they would like. They still have banquets and social interactions and so on. We could be facing a far worse situation. But the intervening Chinese New Year has been most unfortunate for Hong Kong because despite all the warning from myself, the Secretary for Food and Health, and all the social distancing measures, the reality is during the Chinese New Year, there have been a lot of cross-family gatherings. And as a result, this highly transmissible Omicron was spreading like fire. But now I hope that at least we could have seen the peak of the infections past, and it is for us to remain as vigilant as possible and try to suppress the epidemic as soon as possible. And when we are in a better position to assess the likely outcome of the wave, I have promised that we would devise a roadmap in anticipation of a future wave, whether it's of COVID-19 or another virus. Thank you.
好，下一位記者嘅提問。後排嗰位男記者。
Gentleman at the back. HKO1, couple of questions, if I may, for the Chief Executive. Yesterday, you said that in the battle against COVID, everybody is really dedicated to their work, and we saw the senior officials involved in the birthday party. Now, otherwise, Mr. Jack Chen wouldn't have been here. Do you think that everybody is dedicated to the tasks? Now, you said that over the Lunar New Year, people had a lot of gatherings against better advice. Is it really the reason? Second, you said the whole purpose of RTD is to achieve zero COVID in the districts. Is the government trying to achieve dynamic COVID zero, or is it the case that, like the expert said, we should be achieving living with COVID with Chinese characteristics? Now, Mr. Patrick Nip said that if the senior citizens are not willing to get the jab, there are some ways to make them do so. Is it a kind of compulsory? Is it a vaccine mandate? Are you going against your words back then? Are you going to impose vaccine mandate on certain groups of people? First, as SAR government, we have 180,000 civil servants. We cannot guarantee that every single civil servant's behaviors outside their line of duties would be in line with the anti-COVID requirements. There was an incident that happened, but I've already handled this in the spirit of accountability. In the entire anti-COVID battle, we still haven't decided on the roadmap. We are still in the battle. I think we have to look at the development of the pandemic and see what measures that would best be adopted to handle the situation. President Xi, if you remember, a couple of days ago at the Politburo, made a very important speech, and basically we have to adopt the most stringent measures, and we have to heighten our vigilance in our battle against the pandemic. But President Xi also said that in the course of battling COVID, we have to maximize the results with the minimum costs. In particular, we have to have regard to the economic situation. In a way, over the past 2 years, we keep saying that there are 3 factors at play. First, we have to have the consideration of public health. Second, we have to have the consideration of the economic situation. And third, we have to have regard to the public acceptability. So today, I don't think I can give you any idea about the way forward. I don't really want to get bogged down on any particular narrative, because this can give rise to different interpretations. Third, vaccine coverage for the senior citizens. This is indeed a difficult, a challenging issue. From the moral point of view, from the personal choice point of view, from the public health point of view, I think we should administer vaccination with only with consent. But we have seen the result of the senior citizens. The under-vaccinated elderly population is resulting in a very high mortality rate. So for the senior citizens, or indeed the senior citizens in the elderly homes, I think we have to ramp up the vaccination program among the senior population. If we have to resort to a vaccine mandate, I'm not going to take this decision. It's not time for us to take this decision. We're still trying very hard to make sure that the senior citizens will get vaccinated. Now we have completed the outreach vaccination program for the RCHGs and RCHDs on the 18th of March. We have covered 50%, and there are 40% of them who cannot be vaccinated because they have come down with COVID. And according to medical advice, and they have to leave some time before they can get vaccinated. So we're going to have the second and the third rounds to give the jabs to the senior citizens after the gap. But what is most distressing is that there are 10% of the senior citizens whose families are against vaccination. And they have to do so in writing, but still there are about 10% of them who don't want their elderly family members to be vaccinated. We have to protect our senior folks at home. If after a doctor's assessment they can get the jab, but they should be jabbed. It doesn't cost them anything at all. Second, in the elderly homes, we have to protect the fellow residents as well. Third, if the senior citizens get infected and they get admitted to the hospital, we have to protect the hospitals as well, because otherwise, because of the influx of senior citizens into the public hospitals, it would compromise the hospital's ability to look after the other patients. So having regard to all these, it would be hard for us to take the decision to legislate for them to be vaccinated. So it's no good to criticize us to have any policy reversal. I think at this point in time, we have to use our administrative efforts. We have to have our medical teams to give the jabs to those in the elderly homes and also to the senior citizens who are living at home and also in the community. There should be more priority given to the senior citizens for vaccination. We are indeed concerned about the vaccine coverage for those who are above the age of 70% above 80 years of age, 56%. So in other words, for those above the age of 70, there are 283,000 who are completely unvaccinated. So how can we make sure that these 280,000 senior citizens who will be getting the jab? This is one of the greatest challenges in this battle against COVID. And also, this is also a critical factor whether we're going to be able to adjust our measures going forward. So I hope that the media will help us to publicize the importance of getting the jab instead of merely reporting on the mortality rate. That's it for today's press conference. I'll see you tomorrow. Thank you.